Hello, everyone. Welcome to the VCH Intercultural Online Health Network Indigenous Health Round Together. We're very excited that many of you have chosen to join us, and I'd like to welcome you very much on behalf of the VCH Aboriginal Health Unit, the BC Ministry of Health Patients as Partners, UBC Department of Emergency Medicine, Vancouver Physician Staff Association, and the Intercultural Online Health Network. I know many of you come from VCH, but also many of you are coming from other health authorities or other groups. All are welcome. Thank you for being here at this learning place. Really, there's a focus to understand how we can support cultural safety and also serve our Indigenous community members and patients well through our health system. And so really looking forward to interacting with you. And today we have both Elder Dennis and also with Jessica Key as our key speakers. And momentarily, I'm gonna ask Leslie Bonchar, the lead of the VCH Aboriginal Health, to introduce them. And so again, thank you very much. We'll be keeping everyone muted. We've been having a great response. Thank you so much. We have over 300 people registered for this event. And so thank you very much for your enthusiasm. And so I will have a little bit more information about in the upcoming round, in this round, how to ask questions, etc. But right now, let me pass it over to Leslie Bonchar. So Leslie can take over the introduction. Leslie?
Thank you so much, Kendall. It's great to be here with everyone in our virtual circle. My name is Leslie Bonchar. I am from the Shiatkin First Nation and also the Nooksack Indian tribe. I come to you today from the unceded territories of the Semiahmoo First Nation out in White Rock. Our land acknowledgement will extend past that though, so more on that in a moment. For work, I am the Executive Director of Aboriginal Health here at Vancouver Coastal Health and have been since October 2015. Prior to that, I was with Fraser Health Authority, and that's where I first met Kendall, and we started doing some work together on cultural safety and inclusion of traditional knowledge practices. So I want to take a moment just to say thank you so much, Kendall, for the incredible partnership and journey that we've been on together for the number of years that we've known each other. For all of you calling in from wherever you are, you're somewhere in a traditional territory of a First Nation Indigenous group. Some might be in the general Coast Salish territory, which Elder Dennis will tell us more about his homelands. Our corporate office of Vancouver Coastal Health is on the unceded homelands of the Musqueam, Squamish, and Tsleil-Waututh people. So often, because we're grounded there and we're all big decisions are made, we're going to acknowledge that location today. And then just take a moment for yourselves from wherever you are, wherever your feet are planted right now. Think about the traditional host nation that has welcomed you to live and play on their land. I am honored to introduce our panel and guest speakers today. Elder Dennis, I'm going to start with you. You have such a long, accomplished biography here. I'm going to hit some high points. I'll leave some for you to share when you start your discussion with us today and your sharing. It's just incredible. And Jessica, I'm so honored to finally meet you and see you in person, and we'll have to connect more and learn about your background. Jessica and Dennis are closely related to Indigenous health, both from a personal perspective and from a professional perspective. Elder Dennis has been helping us as our Aboriginal health team through our Indigenous Cultural Safety lead, Janice Wardrop. Thank you so much for being here. Priscilla, thank you for being here. And Colleen, also Aboriginal health team members. Elder Dennis has been sharing his gifts of song, of knowledge, of caring and generosity with many of our patients in our hospitals, but also helping us to do training for hundreds and hundreds of Vancouver Coastal Health employees. I want to say a special thank you for the beautiful song you sent to Vancouver Coastal Health healthcare providers during the first start of our COVID-19 pandemic. It was healing and very, very generous and thoughtful of you. So thank you so much for doing that. Jessica is a nurse in Vancouver Coastal Health that I've heard a lot about, and was featured in a story about us not that long ago about cultural safety and caring for Indigenous people. I'm honored that you've taken up the opportunity to support our work in so many different ways over the last couple of years. You are definitely going to share more about yourself when we get started. So it's always best to come from you, Jessica. I'm honored to say that you're from my husband's territory as well, which is always good to meet another relative, the Muskimok Dowdinuk. And I have practiced that literally for 20 years, and I still can't get it to just roll off, but welcome and thank you for sharing your beautiful talents and gifts with us. A little bit about Aboriginal health. For those of you that are new to learning about Aboriginal health and what we do, it goes back to a time when there was something called the Transformative Change Accord. It goes back to 2005, when all of the regional health authorities across the province were given a real call to action with about 34 different goals. And one of the goals, I'll never forget it, because being a lead at Fraser Health, I thought, how on earth are we supposed to do this? The call to action was to provide Indigenous cultural safety training to every single health employee in the province. And I know in Fraser Health, there was 20,000 something employees, this equally large amount here in Vancouver Coastal Health as well. It was a pretty aggressive goal. It came with a bit of funding, but not very much, as you can imagine. It's one of those things that's hard to describe and put a price tag on what this means. But I can tell you that over the 15 years I've been working in regional health authorities and helping to encourage and bring Indigenous cultural safety training to healthcare providers, it has been an incredible journey. I am so thankful for our team, our Aboriginal Health team, our knowledge shares, the ones like Elder Dennis, who have been so gracious and generous with their knowledge. Musqueam, Squamish, Tsleil-Waututh people, the Sea-Shelt people, the Newhawk, the Healtsick, all throughout our territory, we have knowledge keepers who are willing to help share and willing to come work side by side with us as we try to increase knowledge and awareness around Indigenous cultural safety for all of our patients and all of our clients accessing care, and making a safe work environment for Indigenous employees to join this workforce and share in this workload. I'm super excited and honored that the leadership here at Vancouver Coastal Health, including Kendall and many of his colleagues, have signed on to this cultural safety agenda with us. We have a cultural safety policy that was endorsed and written in 2015. Not many health authorities have an actual policy that states that we will provide culturally safe care. We will provide opportunities for Indigenous patients and clients to access culturally safe care and have access to traditional knowledge keepers and cultural practices in our centers. So I'll stop there, but just to say that it is quite a journey. And as an Indigenous health leader myself, I'm proud of the work that we've done. It is an ongoing journey. I don't think we're going to ever reach the full destination. And so to keep in mind and keep that message going that this is learning. Today is learning. Thank you to all 219 participants that are currently on right now. Thank you for coming to learn with us. We're here to share knowledge. We're being generous with our knowledge. We want you to be curious. We want you to find a way to put to use what you learned today. And if you don't learn everything, if all your questions aren't answered today, which I'm sure they won't be, please reach out to us. We're here to help. There's a mighty little team of us that are here to help you with this journey. So thank you so much for joining. And I'm going to give it back to Kendall to continue on with the facilitation of the conversation. Oh, sorry, no, I'm not. I am going to give it to Elder Dennis to do the opening prayer to get us off on a good start. Thank you so much, Elder Dennis.
Osiam, thank you. I thank you, my high relative, for sharing that. I'm grateful and thankful to everybody here today. And I want to invite you to, as I begin to share our prayer in the language, and I'll translate to English. But if you have a way to pray, to share in your own way, in your heart and your mind, and if you don't, my invitation is for kind thoughts, for the work that we have before us, not only today, but the days that are coming. I'm grateful and thankful to Makwitsi Kutsnecham, to fellow elders from Aboriginal Health, to all of our elders who share to make humanity a better place and hot. Very good. Osiam Tanoya, Hoicho Hachanak, Chasiam, Hoicho Tisha Ochameo, and hot since Squallowan, Cold since Stomo, Yo and hot, and Skacha Stomo, Siam and Siai, Yo and hot, and Munt, and hot, Makwitsi Kutsnechum, COVID, Yo and hot. I give thanks to the Creator today, Mother Earth, and all that she provides. We are grateful for. Hands are up to all of the ancestors who've gone before us. I'm grateful and thankful and welcome friends and relatives from the four directions to this gathering today. Ask for healing prayers for each and every one of you who are in need of healing in your heart, mind, and spirit, especially those who may be at home or shut in, that their Creator place every healing hand upon them, especially those who are in suffering throughout the world from this COVID-19. We ask for strength and healing in each and every one of them, in each and every one of us, and those who are seeking to help them. Osiam, thank you.
Thank you very much, Elder Dennis. Let me next introduce Dr. Jim Kristensen. I first realized that I did not introduce myself, so I apologize for that. My name is Kendall Ho. I'm an emergency physician in Vancouver. I'm also a member of the Department of Emergency Medicine, lead a unit called Digital Emergency Medicine. And it's my pleasure to introduce my department head, Dr. Jim Kristensen, my colleague, emergency physician, also lead of BC Emergency Medicine Network, to welcome all of you. Jim?
Thank you, Kendall. And thank you, Leslie and Elder Dennis. I always really enjoy the opening prayer. It's so important. And welcome everybody to this very important meeting. The number of people really does show us that there's so many people interested in this and how important it is. I've been doing some work with the Nuu-chah-nulth Nation on the west coast of Vancouver Island, and trying to see how we can improve emergency care there. And it's been an amazing journey for me. I have learned more and benefited more than what I have given so far. I hope when we figure it out to be able to actually improve care, and so we're looking forward to that. But it's been a very heartwarming and an important journey for myself. And emergency departments are chaotic sometimes. It's difficult to manage at times. And I think it's probably even more important that we understand cultural safety, ways of potentially incorporating Aboriginal ways of healing, and learn them really well, because when things are going really fast, it's not something you can always just pause and try to kind of figure out. So I think it's even more important as emergency practitioners, and I know this isn't just about emergency, but that we really do understand the basics of cultural safety and live them and practice them on a daily basis. And I look forward to enjoying hearing Elder Dennis and Jessica Key talk about more of the things that we might be able to do in a practical way, so that we can start using them more and more until it's just second nature for us. So thank you very much, Kendall, and the whole iCON team for putting this on, and all the energy you've put into this. It's very much appreciated.
Thank you very much, Jim. Again, I'm going to momentarily invite Shannon Gibson from Ministry of Health, Patients and Partners to give us some opening remarks. Within the digital emergency medicine, I also take on the role of Executive Director of the Intercultural Online Health Network. This effort has been going for 11 years in partnership with Ministry of Health, patients as partners, looking at how do we support patients with chronic diseases in the different cultural communities, and also have the pleasure of really working with Indigenous communities together on this. And so again, thank you, Ministry of Health, for this support. And Shannon, let me invite you to welcome our audience.
Great. Thank you very much, Kendall. And I'm reaching you today from Victoria on the traditional territories of the Wasanich and Songhees and Esquimalt First Nations. And so as Kendall mentioned, we're really excited that the Ministry of Health Patients as Partners initiative has been able to partner with UBC iCON for more than 10 years. And I've had the privilege to attend a number of these educational events over the past 2 years. And so it's really exciting. I've been watching the number of participants continue to tick up, and we're currently at 233. So I'm so impressed with the level of interest in these educational events, and I look forward to continue to partner with iCON and to watch this initiative continue to grow in the future. So thank you very much, Kendall, for the invitation.
Great. Shannon, thank you so much. We've been having these rounds over last year, and this year we are able to kick this off. And I really want to thank the Vancouver Physician Staff Association, part of the Doctors of BC agreement with Ministry of Health on engagement, facilities engagement. And I want to thank VPSA in supporting this event together to move it forward. Let us jump right into the contents. As an emergency doctor, what sparked my journey and really want to learn about how to serve our Indigenous patient well occurred one time when a patient came into hospital because of a car accident. And my routine after examining the patient was to recommend x-rays for the neck in this particular situation. And our Indigenous patient, who speak very gently and also very articulately, said, I would really like to have traditional practice to support my healing. At that point, I was at a loss. I really didn't know how to respond because I know nothing about traditional practice. I really know very little about interaction and also cultural safety. And so throughout this few years now, for the last 7 years, I've been really learning a lot from different leaders like Leslie, and also having elders guiding me along the way. And so this rounds are really, hopefully, is a good exchange for us as health professionals to learn as Indigenous patients come to our facilities, our clinics, our hospitals, our emergency department, how can we serve them better? How can we actually be able to deliver the type of care that they would like to do? And so today's round is really about how do we look at cultural safety as it practiced at the coalface of the clinic. And I'm very fortunate to have both Elder Dennis and also Jessica Key, as Leslie have introduced, to be able to give us some really fantastic insights. And I hope that it will be very practical for all of you. A couple of things before we start. Please note on the chat box that this session is being recorded. And also, please, because of the number of people that we have, we welcome your questions, but we ask that you type in a chat question in the chat box. And then Bretta, my colleague, will be keeping an eye on all these questions so that we will be looking at those questions and ask our panelists to respond to your questions. I also know that many of you have great questions, great comments. We may not be able to address all of them today, but what we'll do is for the comments that you put in, we'll certainly continue to track and learn, and this will also inform us in the future in terms of the different rounds that we'll be doing downstream. And so your thoughts will always be welcome. I will always want to learn from you. The third motivation of this round is that the Truth and Reconciliation in Canada is very important. And of course, in October of last year, we have embedded it into our legislation BC to practice this, so that for the Truth and Reconciliation, the Action 22 is to say, we call upon those who can effect change within the Canadian healthcare system to recognize the value of Aboriginal healing practices and use them in the treatment of Aboriginal patients in collaboration with Aboriginal healers and elders where requested by Aboriginal patients. So hopefully that today with this round, we have some really good exchange, and we look forward to Elder Dennis and Jessica to give us some thoughts about in the co-phase of practice, what do they observe and how would they advise us. And so let me first start. Maybe I have a couple of questions to ask Elder Dennis and also Jessica. And then after 2 or 3 of the questions, we'll open up to the floor for everyone to ask questions and make comments. All along the way, as you have thoughts or comments as audience members, please use the chat box. Maybe Elder Dennis, if you don't mind me asking you this first question, and then
Sure.
I'll go to Jessica also. Could you tell us a little bit more about yourself and how you have seen cultural safety and cultural humility practiced by healthcare professionals? What are some of your insights there? I welcome your thoughts.
Oh, by way of background, very quickly, I worked for Squamish Nation for 40 years, and 28 of those years was as an elected official, consecutively being elected every 4 years. And for 25 of those years, I volunteered and co-founder of a movement called the Squamish Nation Peacekeepers. So I did a lot of work with BC Coroner Service, West Van, police, RCMP. And also during that tenure, I was asked by an uncle to take over his traditional role that I'd seen 2 other uncles do in my lifetime. And quickly to describe them in today's terms, they were like village coroners. They were first responders, going to homes, to hospital, to tragic events. And in my tenure, we were often first on the scene to support a loved one that passed or support a family or both. And did that for many, many years. When my uncle asked me, he said, take your time. You've seen how much time it takes to do this kind of work. And for over 20 years, I was on call 24/7 and built a lot of bridges along with many others, with policing, the coroner service, attending hospitals, doing some palliative care from time to time, which was very rewarding for me in its own way. And I miss that work. And yeah, I never thought I'd see the day I'm an elder now. Yeah, thank you.
Wow, great. Thank you very much, Elder Dennis. Maybe Jessica, let me also welcome you and love to hear a little bit more about yourself and also how have you seen cultural safety and cultural humility practiced by healthcare professionals. Your thoughts, Jessica?
Gail Kasla, Nugo Kwapa Lagwa, Nugo Muskmak Zaudena, Gail Plan, Guayi, Glue Samade, Glue Vancouver. Hi, thank you so much, Kendall, for the welcome and the opportunity. My name is Jessica. My Kwakala name is Kwanpa Lagwa, which translates roughly to Thunder Woman. And I currently am coming from sitting on the traditional unceded territories of the Musqueam, Squamish, Tsleil-Waututh nations here in North Vancouver. But I grew up in Yellowknife, and my family comes from Kinkum Inlet in the kind of north end of Vancouver Island and the coast. So I'm a registered nurse. I've been a nurse for 3 years. And during that time, I've worked primarily in youth concurrent disorders. So youth, teenagers struggling with mental health and substance use challenges of various kinds and natures. And I love it. I love my work. We do see a kind of disproportionate number of Indigenous youth that come through our service. And, you know, if we acknowledge that, you know, Indigenous people make up less than around 3% of the Canadian population, and we see a very high proportion of our youth are Indigenous from various nations. And so something that's been a keystone and cornerstone of the program that I work with, the inpatient unit where I work, is a commitment to cultural safety and to cultural awareness And since the very beginning of this program's inception, which was in April 2017, we partnered with the Aboriginal Health team at Vancouver Coastal Health. And so we've been able to incorporate into our programming really strong relationships with elders who come into our programs and provide kind of therapeutic groups with our youth, all of our youth. And so those are things like talking circles and incorporating different perspectives on spirituality, or ways of kind of alternative ways of conceptualizing, you know, kind of like trauma and struggles, and that again that our youth are often dealing with, and have also been available to connect on personal one-to-one basis with our Indigenous youth. And you can see just the incredible impact that has on everybody, and particularly on our Indigenous young ones who sometimes are just really seeking connection with something meaningful, something that they see themselves reflected in, and see someone that maybe looks like them or looks like their family, or and being able to see that as a strength and as a positive, and seeing that respected and honored is very powerful. And so valuable. And so I'm so grateful to be in to be able to support that kind of work. And I just, you know, would like to see that expanded across the board, because all of our youth benefit from that level, that type of perspective. But it's so powerful for our Indigenous youth. So.
Wow, thank you. Thank you very much, Jessica and Elder Dennis. Maybe let me ask you this question. I'm interested, of course, practicing cultural safety. And what are some of the pearls that you would give me? Say, if I were in the emergency department, if I were in my clinic, if I were in my ward, what are some of the kind of pearls that you would say, you know, wow, in this particular case, this health professionals did this that actually lead to true cultural safety? Or I think, Jessica, you raised three very important points. The person felt honored, the person felt respected, the person felt heard. What are some of the things, examples, perhaps you can maybe illuminate me on thinking about what does cultural safety look like in the actual practice when we interact with our patients? I welcome both of you for some of your thoughts on that. Maybe this time I'll start with Jessica, if you don't mind, and then I'll go to Elder Dennis.
Sure. Yeah. So it kind of, as I touched on some of the ways that it can be enacted is, or that I've seen it enacted, is in kind of very literal, in like engagement and incorporation of cultural practices. However, what I kind of see is what's really important and where we need to move in terms of the direction is that it's more like cultural safety is more than individual acts and individual engagements. And so at its core, like at its beginnings, the concept of cultural safety is a concept of anti-racism. And so it's very active, it's kind of radical, and it's challenging, and it's to engage in. And so what that work looks like is maybe less of that kind of like those times that you're one-to-one with a client or a family, and more of how do we every day in every interaction that we have, how are we kind of recognizing and acknowledging the systems and the policies that are in place that are contributing to a racist society and a racist system that are harming Indigenous people, but are harming everybody. We're all a part of the system of colonialism and racism that's really not working. Seeing that today, people really standing up and taking a real stance against anti-racism work, and how we're all kind of impacted by these systems and policies that are in place. And so on a personal level, what that work can look like is research and understanding of the histories, and kind of what has gotten us into the society that we're in today, where our healthcare system and where our justice system and political systems come from, how they've been, originally founded and created, and understanding the kind of inherent oppressiveness in those systems. And only when we understand, that's the truth part of the Truth and Reconciliation, can we begin to walk that path of healing together, when we kind of know where we're all coming from, what the shared experience is. We kind of like start to undo some of these historical and ongoing challenges. And when we can come into things from that perspective of doing that work of understanding and challenging these systems, engaging with each other honestly and caringly and safely becomes a bit more natural and inherent in the systems.
Great. Thank you so much, Jessica. What here is really should start from within with an intrinsic understanding and an attitudinal change, and then to have that kind of authenticity and caring. It's the start of this for sure. Elder Dennis, welcome your perspective. How you see this on this particular point.
Well, I want to share with you some history and appreciate I'm a generation removed from whose parents or grandparents were raised in a longhouse. And it's not that long ago. And during their time, the great-grandparents' time, there were skirmishes back and forth across this country for what we stand on. And what I learned from my great-grandmother, who was at least 108 when she passed, that there was a verbal agreement between the Queen and Indigenous people, her request that the battle stop so that people wouldn't be passing away on both sides, and that all she wanted was the top 6 inches for the farming. Everything below that we would own, everything above that we would own, and for every dollar made that we would get 25 cents. So a lot of the elders of my generation above understand that as a contract, and even I'm teaching my kids that. And even though it's some see it as a sense of obligation or entitlement, that there is that contract that's there. When you're treating people and people understand that, it's not an expectation. It's an approach with sharing and caring and agreeing to get along peaceably in this world. That's the contract, to get along. That's the essence of what that great granny told me, that we need to stop doing this back and forth. And it begins with her telling us this information, understanding that, and going forward. And yeah, there's much more I could share about maybe some of the anthropological side of Canada. For example, quickly, 32 major languages in Canada, and 12 of them are spoken in BC. And they are as diverse as English is to French, and yet there is a universal connection that we all have through our medicine, for example. Yeah, so it's a very quick study of the probably 100,000 plus Indigenous people in Vancouver alone. They're all different.
I appreciate that. Yeah, thank you. And thanks, Leslie, for putting up that chat question. Is to welcome everyone. If you start having questions or thoughts or comments, please feel free to use the chat box, and we will certainly start directing questions, your questions, to our panelists. Maybe to go on a little bit, I'm also thinking, Elder Dennis and Jessica, what do you think are some of the kind of specific factors that make providing culturally safe experience for patients in the healthcare setting challenging? What might be some things that might lead to some barriers or some hesitancy for our Indigenous patients to want to interact with our health system? Welcome your perspective on that. maybe I'll start with Elder Dennis this time, and then Jessica.
Yeah, well, what came to mind immediately was emergency care. And I know it's something that's been addressed in the last few years is the sense of time. And there's triage and there's that sense of time that I constantly hear from family members and others and friends that the sense of time seems to take too long. And I know with this COVID that there was a rash of no patients at all going in to now more and more people going in dealing with their health issues they should have dealt with weeks or months or days ago. So I think that is a concern I hear all the time, that it takes too long. And I know there's shortages and budget issues across the board. Having seen some of that kind of work and understanding it, but that's a concern I constantly hear.
Yeah, thanks for that. Certainly, yes. Emergency. Oh, sorry. Go ahead. Elder Dennis? Oh, okay.
No, that's it. Yeah. Thank you.
Yeah, definitely. Emergency wait time and overcrowding is always a challenge for us as health providers, and also we absolutely know for our patients for sure. Jessica, your thoughts?
Yeah, as Elder Dennis was speaking to, and as you acknowledged there, Kendall, always time and resources are always pointed to as being barriers to enacting kind of any kind of change, but especially anything around cultural safety. But one of the key underlying issues that I see in my work, and I see in my personal life, and I see online, is that to meaningfully enact systemic change and personal internal change, we have to acknowledge what is unsafe about our systems, and some of that's like, this is the way we've always done things, or how the systems are built and the buildings that are built, and these really like big kind of ideas that are really challenging to tackle in any kind of way. And in terms of on that systems level, we've all in some way grown up in a ideology and a worldview that is shaped by colonialism, and that is shaped by again, these like racist ideas and policies, and we're all complicit in some way in keeping these policies and ideas alive. And that looks completely different in across all different areas. And so I'm complicit in it. We're all complicit in it in some way. And to again deliver things that are safe, deliver care that is safe, deliver systems that are safe, we have to address those underlying things that are unsafe, that are making these unsafe. And again, that's painful internal work that we have to do, that we have to acknowledge that we all have biases, that we all have ideas about other people, that we all have things that are automatic, that are deeply rooted in how we've been raised and things we've been exposed to. And we have to be so critical and really critically evaluate the things that we bring to the table every day in our workplaces and in our engagement with our individuals and families and communities that we work with. And that's really hard. It's exhausting, and it's emotional, and it's it takes a lot of skill that we don't hone as we grow up for most people. So it's daunting work, but it's very possible, and there's so many resources out there that can kind of start you on that journey of learning and again addressing the things that we all kind of carry.
Absolutely. Thank you very much for that. And I'm a beneficiary of Leslie's unit, because there are a lot of materials that I'm learning from for sure. Let me go to the questions from the audience. I think one of the first questions is about, do you think it would be helpful for us to work on guidelines that support clinicians to regularly ask, for example, new clients or patients whether they are of Indigenous ancestry If so, how they would like us to interact with them. Do you think that's useful? Maybe I ask Elder Dennis, Jessica, and then also, I know, Leslie, you're working on some policies, whether that's something you feel is helpful. Welcome anyone, welcome your thoughts.
I guess
Yeah.
maybe, oh, sorry, Elder Dennis, go ahead.
No, you go ahead.
Okay. I was going to say, this is really, for those of you that don't know, we've been working on a proof of concept at Vancouver General Hospital, where we took a deeper dive and a more concentrated effort in supporting 2 cohorts there, 350 staff altogether in cardiac and mental health, the Siegel Center, and took them past what you might know already is a SANIUS training, or which is offered through PHSA as an online training, and then our in-house training, which we designed and have been delivering for at least 3 years, maybe even 4. My time has gone by fast, but it takes a deeper look. It does some practice and some role modeling around how to implement the policy that we have around providing culturally safe care and getting to that identity question. It is difficult. I think we have heard that from absolutely everyone, even myself. You know, it is difficult to ask somebody to self-identify as Indigenous. So you do want to know how to do it. You need some training and some supports around it. So I do believe, particularly our clinical staff, they like their algorithms. They like to know you go from one point to the next, and, you know, as you ask questions of your patients and your clients. We do encourage practicing, but also understanding what the benefits are, right? There's always got to be a benefit to the self-identification. If you're in the ER, and you're in a situation, right, that you want to make sure that you have some good supports, or you're providing the best care. Often our way in is to just say something along the lines of, you know, we do have Aboriginal patient supports available at our hospital, both through our navigators that help with some of the health benefits, and we also have elders in residence to provide cultural and spiritual care. Would either of these be of use for you? And you know, that opens the door. It's open-ended to start a conversation. I think curiosity, knowing how to find some cues, read some cues of somebody. Often we'll say things like, where do you live? Indigenous people don't respond well to where do you live? And part of your previous question, Kendall, about what creates a culturally safe care. When I've asked that question to many Indigenous people as part of a research project that we did back in Fraser Health, they said to me, you know, Leslie, I don't need them to know my cultural practices. I just need them to know I have cultural practices. So what a difference that is between saying, you know, what's your culture, to are there cultural practices that you would like included in your care plan, right? That opens the door to a conversation. It's curiosity. We are trying to develop as many tools as possible inside the Health Authority. You'll go on to our website and you will see that there is a booklet we created around Indigenous cultural practices and knowledge, and it's not a how-to book. It is a little glimpse into leading you down a path of learning more. It's giving you some hints. It's actually an app as well, so you can download it on your phones. Again, it covers things like traditional foods, death and dying, birthing. We've covered a whole gamut of different areas where we know as Indigenous people we may have additional needs and desires in our care planning. Did I answer everything there, Kendall? Sorry.
Yes, very good. No,
Okay.
I really appreciate that. And so momentarily I'll go to Elder Dennis and welcome your thoughts also. And all audience, welcome your comments. I'm really having a great time reading your comments and your thoughts. Very, very great thinking that you put into there. So I appreciate that a lot. Elder Dennis, your thoughts?
Well, I appreciate the reply that's been provided, and I really, really support that. And open way that it's going to be approached. And as I mentioned earlier, it was one of my approaches when working with professionals, with families, and it really is a good teaching to help me along my way, and I want to support that because it is ever respectful and honorable to find a way to support a given family and or given culture, in this case, Indigenous culture. And I thank you for that. And if I could provide input into that as time goes on, I'd be happy to do that. Given some of the background that I've had and ways to deal with it. And it really begins with professionals having to educate that side, and I really hold my hands up to you for the commitment to do that, to add to the many thousands of documents that you need to learn in your tenure and continue to learn, but it helps us all. I really appreciate it. Thank you.
Excellent, thank you. Jessica, oh, sorry. Jessica, your thoughts?
Yeah, I don't know if they're, I think something that we have to, that's important to keep in mind is that, and Leslie touched on this and Elder Dennis has touched on this, is that there's not a universal Indigenous experience or need. And folks come from myriad of nations. There's so many different nations, so many different languages, different language groups, different worldviews, and then each individual person has a different experience within that kind of background and heritage. And so something that I feel is really important to acknowledge is that we need to, as practitioners, in our efforts to be safe and informed and be providing these things, is that we can't assume that people even want to self-identify or even want to kind of engage in care with an Indigenous perspective. We can't assume that every Indigenous person is going to want the same type of cultural practice or cultural services or anything like that. So I appreciate some of the suggestions around like how do you ask, like training around how to ask questions or how to offer those things is important, because everyone has their own lived experience and their own needs, and just like everyone else. And so yeah, that's kind of my piece about that. So it's hard to put that into a protocol. It's hard to put that into a checklist or anything like that, because it is very kind of dynamic and curious and humble kind of process.
Indeed. Let me ask another question that came early on, and is an important one. Have our Indigenous patients seen a difference in care they receive since the health authorities have introduced cultural safety training? Do you guys experience that? Do you guys witness it? And if you do, what type of change are you seeing? Welcome some thoughts there.
I'd like to speak to that if
Please.
I'm not talking over anybody. I think that's a great question, and I have not seen any like evidence or process that's examining that in kind of a evidence-based way at this time. Although I think that would be something important to pursue, to understand, because as we touched on before, this process takes time, and you kind of have, like, it's important to have the arguments to support that this is important work outside, the evidence, because we're all very evidence-based and evidence-informed professionals. So I think that's definitely an area that needs to be explored a bit more, because I haven't come across that evidence yet. However, in saying that, the systems in Canada have been in place. We're at over 150 years of Canada being Canada, and we're looking at hundreds of years of colonization and colonialism. And so that's a long time of impacts and harms and ideas and policies. That are we going to solve that in 10 years of cultural safety training? It's going to be a long journey, as Leslie touched on at the beginning. We're in this for the long haul, and it's going to take a lot of work, and it's going to take effort from everybody to really make those meaningful and systemic impacts that need to be in place for this to really make that huge difference. I'm not saying in any way, shape, or form that what we're doing today is not making a difference. I just want to acknowledge that we've had a long time to get here, and it's going to take time to get to where we want to be as well.
I can add a little bit more too. Thank you so much, Jessica. It is a tough question, Kendall. It's a big question, especially because we have a lot of things not playing in our favor. And one of them is identity in the system. So being able to glean from our CST, our clinical systems transformation work, or our electronic medical records have never captured identity. And so patient satisfaction reports that it may be done periodically through different mechanisms, mostly through the ministry, wouldn't even identify which people were actually Indigenous and whether or not the experience was good or bad. And the complaint system, don't even get me going on that. So those things do need to be tackled, and we were trying basically with the proof of concept in this pilot project at VGH is to work at finding the clients and patients that identify as Indigenous, and then following up and asking them. So that's a couple of conversations that are going on. We do have surveys that we use, because that's the only tool we have right now, but we try to do talking circles. We try to bring patients together to share their experience with us in a very safe way. Someone else here mentioned in the chat about urban, most of the solutions are urban, and there's some rural needs, and we absolutely totally agree. I've highlighted our urban work, but believe me, our team has packed its bags and gone all over this region and spent numbers of days in Helpsick and New Hawk and Slayam and up in Powell River and Seashell doing the training. So everything that we do is mobile. And another good point that Janice made in the chat too, cultural safety and training and what we do and how we measure the impact right now is only on our workforce. And that has been our only goal so far. Patient experience measures is something that we're going to work towards measuring, but right now our focus in Vancouver Coastal Health and through the provincial commitment and our partnerships with FNHA is acknowledging that it's the workforce is our vehicle, our most valuable asset to mobilize this work, to make this work real, to get the effect we're looking for, is to work with our people. Now there's several roads we have to drive on at the same time, and we will merge at the end. And so one road is to the employees that we hire and pay now to do the work and to care for people. There's the pathway of partnerships with UBC, VCIT, SFU, UFV, all of them, everybody who is training any healthcare providers. We want them graduated and entering into our work system knowledgeable already, right? Like right now, you've made lots of great points, Jessica. We're catching up. This stuff is now going to be taught in school. I have 2 grandsons who are learning how to speak Halkomelem in school, right? There's 2-3 generations that didn't get that knowledge. The history that we're teaching as part of our Indigenous Cultural Safety training, 500 years history, to employed Vancouver coastal health professionals, who 9 out of 10 of them say to us, "Oh my goodness, how did I not know this?" Right? Well, because they weren't taught in school. So we have to go down several lanes at the same time, hoping that, end goal, we've got a change. We got the people coming through school right now. We've got the employees that are careers early in their career. Like I noticed somebody was saying they're still in med school in the chat box. We want to get them early enough in their career that we can start to incorporate cultural safety for all cultures at the beginning instead of at the end, or trying to insert it later on. So there's a lot of work that has to happen. We don't expect miracles overnight. This is a journey. It's a marathon, not a sprint. And it takes everybody. and everybody plays a role. One of the things we've talked about cultural safety isn't just about the care. It's actually about the bricks and mortar. It's about how we design facilities to ensure there's cultural safety every time somebody walks through one of our buildings. It's about the policies. It's about everything. So we have, we've got a lot of work to do, but we have huge commitment. This is in the mandate letters. This is a responsibility. Somebody asked about leadership. It is a responsibility of the leadership to enact upon, UNDRIP, and uphold the United Nations Declaration of the Rights of Indigenous People. If you don't know about that, please read it. Please go to our website, follow our YouTube. There's tons of videos and recommended reading sources and everything. It's up to you. It's really up to all 228 of you to also figure out how you're going to get there and how you're going to support this work. Be curious, come along the journey, but first and foremost, you must come with humility. You must come knowing that you also have something to learn. And that's the door that needs to be opened wide by everybody. Thanks, Kendall.
Wonderful, Leslie. We only have a few minutes left, but I want to capture, Elder Dennis, your thoughts on this before we end. Elder Dennis?
Yeah, I can really only speak from my personal experience in the health system prior to Aboriginal Health. And, I would say over that tenure, it's gotten better. Like mentioned, we got a long way to go. But I think put on my political hat when I really saw things turn a corner was before and during 2010. Nations, First Nations, Indigenous groups across this country all participated, including the 4 host First Nations here. And it's just my political hat thinking when I was in the system then, I saw a mood change, more positive attitude. There was an educational aspect to this amazing health experience that we co-hosted with Vancouver and Whistler and 4 host First Nations and Indigenous people across the land. But I think, as mentioned, it does get down to policies and people's will to learn, to understand, to grow, and to unveil this, what I call Canada's best kept secret about the residential school experience. Learn as you do in any of your studies, because it is a part of us and we are a part of you. And that's what we've been saying, and that's what I mentioned earlier. That as we do better, we all do better. And that includes our health. Thank you.
Excellent. Thank you so much, everyone. We're 3 minutes away. We want to finish on time at 1 o'clock. I know many of you have certain time limits. Again, really appreciate you joining us. I've learned a lot from this session, not only about the fact that, the patient in front of us, not only Indigenous, for all patients, that we honor them, we respect them, we hear them. I think that's going to be very important. And also thinking about the authentic and caring attitude that we need to start, and our commitment to anti-racism, to recognize the systemic contributing factor to systemic racism and committing to correct that. And the curiosity and humility to approach this and to have active listening, and also really appreciate the health authorities and also the different groups giving us resources so that we will be looking at those resources to learn. And I also love that word about the journey. I think I really want to thank the more than 200 people that in this, and I'm sure there are more health professionals working together. And we all start this and not start, but continue on this journey together to learn. I think that's going to be very important. I want to take this time, really want to thank our 2 panelists and speakers, Elder Dennis and also Jessica Key, for sharing your experiences. I really want to thank Leslie for your leadership and also my learning from you about in a health authority how to move this forward. Also thank the Aboriginal team. I also want to thank very much the Ministry of Health, support this, Department of Emergency Medicine, Vancouver Physician Staff Association as facilities engagement, working together with iCON to support this event. We're going to post a link for evaluation. We really love to hear your thoughts, whether you are certain points that you have picked up from this, certain things that we have missed, certain things that you want to hear. We love to learn from you. Secondly, I'd like to let you know that the next round will be on September 22nd, on a Tuesday at noontime. So we will be sending that out, and also with the evaluation, we'll send out a link. Love to hear from you. And third is that this event is recorded, and we'll let you know where the recording will be. So in case you want to revisit some of the resources on the chat, some of the information out of this round, that you're able to revisit that. And also, we look forward to working with all of you to move forward on this. I finally want to thank Leslie's team, Colleen, Priscilla, Janice, and also want my iCON colleagues, Miriam and Bretta, for making this round available, doing a lot of background work and administrative work to make this happen. So I want to thank you. And finally, thank you very much, everyone. I hope that this round not only help us to pick up some knowledge, but also pick up a lot of love and a lot of hope and a lot of aspiration that, in fact, we will overcome systemic racism. We will be able to practice cultural safety, and we will serve our patients better. Thank you very much, everyone. Have a good afternoon. Hope to see you next time.